What's going on, guys? It's Coach Salman with Is the MMA. And about 10 years ago, I tore my ACL. Basically, I was attempting a takedown, and my partner's weight shifted in an awkward manner onto my one leg. And then, after that, all I heard was, pop, pop, pop! I looked down, screaming in pain, and my knee had folded over on itself sideways. I couldn't afford to get the ACL reconstruction surgery at the time, so I had to look for a different means to deal with it. And at one point, I thought I would never be able to play any type of sports or do anything like that again, because for about 2.5 years, even simple things like walking fast or trying to jog would make my knee buckle, and it would give way and get re-injured, and it was unstable for about 2.5 years, even with the simplest of motions. And actually as well, on a different occasion, I tore the ACL on my right leg as well. But on my right leg, it was just a partial tear. Whereas on my left leg with the 3 pops, it was a complete tear. But nevertheless, fast forward 10 years and here I am now. I train 6 days a week, spar 3 to 4 times a week, takedowns, jiu-jitsu, wrestling, boxing, Muay Thai, all of that. And I'm able to do all of that without any ACL on my left leg and without having had the surgery. So sit tight, I'm gonna jump in the shower right quick, then we're gonna head to my office where I'm gonna give you the details of exactly how I did it. I'm gonna tell you everything you need to get it done, and also give you some info about what to expect if this is something that you're gonna have to go through as well. All right, so hang tight and we'll get started in just a sec. Yo, what's going on, guys? All right, welcome to my office. So let's get right into it. The first thing we need to ask ourselves is, what are ligaments? So ligaments are basically elastic bands that limit the movement in your joints to keep your bones together. So in terms of the knee, you have 3 ligaments. You have your ACL, you have your MCL, and you have the PCL. This keeps the knee stable and avoids it from hyperextending and from coming apart. That's basically the function of ligaments. From my experience, the most common injury I've seen in terms of ligaments is the knees. And mostly it's the ACL. But sometimes you also get tears, partial or full tears, in the MCL and the PCL as well. So then the question arises, do you have to have surgery for this to heal or not? And if so, what are the risks and the benefits of the surgery? Mind you, when I had this injury, it was over 10 years ago. So I'm gonna give you a breakdown of what I've learned over this time period so that you can make the best decision possible for you. Now, we have to understand why it's so difficult for ligaments to heal. The ligaments have very limited circulation, not enough blood. So if they get a full tear, it's not gonna heal on its own. But that doesn't mean that you have to have the surgery. There's athletes, professional athletes that I can list for you that have done professional sports on the highest level of competition that didn't have an ACL at all. One of them was John Elway, Thurman Thomas, Mickey Mantle, and that's just to name a few. And then in my own experience as well, I don't have any ACL on my left leg. So what's going on? So how is that happening if the full tear is never gonna heal again? I'm gonna tell you how that happens, but before we get into that, I wanna discuss the benefits and the risks of the surgery. Many athletes, many pro athletes, MMA fighters, and other athletes, they opt for the surgery. The reason is because when you get the surgery, what they basically do is take part of your ligament from another part of your body, your hamstring or something like that, or they take it from a cadaver like an animal, a goat or a sheep or something like that. They take a piece of a ligament. They basically go in there and they drill up in your knee, and they use that extra piece of ligament to connect your knee ligament that's snapped, that's broken. And so after a while, it fuses and it becomes part of your ligament. The reason they do that is because with that, many times with that and some rehab, they can get right back to playing their sports, sometimes in as early as 5 or 6 months. Whereas if you don't have the surgery, it may take a lot longer for you to be able to get back to playing your sports. But what you have to consider is that professional athletes usually have a lot of money. And so they can afford to get the best doctors. And they can make sure that the doctor that they use has worked on professional athletes before, and those people have been able to rehabilitate their knee and go back to playing their sport. The average person now, if they get a surgery and the doctor messes up their knee, then there's no going back, right? So, and I've seen people like this where they got knee surgery, and then after they got the surgery, they're in a worse position than they were before the surgery. Basically, they completely messed their knee up, and there's no way to fix it because they done drilled all up into the knee and did all kinds of stuff to the knee. So if you're going to have the surgery, you really need to make sure that the doctor has done this particular surgery multiple times, and not just on regular people, but on athletes. And those athletes have good reviews and they were able to get back to their sports, etc. So now that that's out of the way, let's talk about how exactly does it heal then? How are people continuing playing sports if they don't have any ACL? You're going to basically strengthen the muscles around that ligament, and then the muscles start to compensate and they start to do the job of the ligament. And all the while you're strengthening it, you're going to be taking certain supplements and herbs and doing certain exercises, special exercises and certain stretches that are going to make that ligament stronger. And the muscles in the brain, they learn slowly. So what you have to do, in addition to taking the supplements that I'm going to tell you about and doing the stretches and the exercises, what you're going to have to do is you're going to have to slowly rehabilitate that knee. And so the things that make it uncomfortable, that make it unstable, that make it come apart, you have to basically do those things a little bit at a time, gradually, and at the smallest variation of them. So for example, if lateral sideways movements are what's making it unstable, you have to do those movements every day, but do them in a real slow, controlled fashion on stable ground, so that you're giving your muscles the time to learn and understand, to tense themselves up, and to hold everything together when it's in a position that's vulnerable. Let's say you want to do a Muay Thai kick on a heavy bag. Okay, the higher you kick, the more the angle is going to be taxing on your knee. So what you want to do is you want to start off a few months just doing barely even kicking at all, like just going through the motion at the lowest possible spot. After a few months of that, if you're comfortable with that and your knee isn't giving out, you gradually lift it an inch higher, a little bit higher, and start to kick a little bit higher. After a few months of that, you can start to go higher. After a few months of that, you can start to go higher, etc., until you can kick head level again. Personally, there was one point where I thought I could never throw a kick again because my knee was so unstable. So I pretty much did exactly what I just told you. At the moment, I'm able to throw head kicks again, and my knee doesn't give out because my muscles are tense. My leg muscles are tense, and they've learned to compensate for what the ligament used to do. And that applies to any type of movement. What you have to understand is you have to just do it gradually, slowly increasing intensity over a long period of time until your muscles compensate. So the reason the ligaments don't heal is because there's no blood, there's no circulation, okay? And so if it's a partial tear, it can heal. Okay, what you want to do, you want to massage it, all right? You can massage it by hand, just every night, massage it to get the circulation going. Or you can buy a special sports massager. I'll leave a link in the description of the video for the sports massager, for the supplements, for the braces, and for everything else that you're going to need. So basically, however you do it, by hand or with the massager, you want to basically massage the area so that it increases the circulation. You want to stretch with particular stretches. I'll tell you about those right now. And you want to do particular exercises, okay? And then you want to take the supplements. So in terms of the stretches, the first one is like this, all right? Here we go. I'm going to show you right now. You're basically going to lie down on your back, all right? Once you've lied down on your back, you're just going to make circles, large circles with your legs like this. All right, just like that. You're going to do that for about 1 minute. Then what you're going to do, you're going to do it the other way. All right, just like that. And you want to do all of these regularly, and especially before you do any kind of training. Okay, the next one, you're going to stand up
You're going to put your hands on your knees like this, and you're going to make big circles like this. All right, 1, 2, 3, like that. Okay? Let's say you do about 20, just like this. All right? Then you're going to do the same thing the other way, like this. Boom, 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 boom. Just like that. All right? So 20 this way, 20 that way. The next thing is this balance board thing right here. Okay, this thing is very good because when you step on this, it's not really stable. So it's training your muscle to be ready even if the ground isn't stable. It'll help you. It'll help your muscles to compensate for what the ligament is supposed to be doing. So you want to get on this thing just like this. You want to balance. And basically you're just going to do squats. But the thing is as you're doing squats, the balance board isn't going to be exactly stable. So your muscles are having to work in all types of ways and directions that they're not commonly used to. So you're going to do a few like this. Let's say about 20. All right? Let's say 20 like that. Then after that, working out the legs. Basically jogging. All right? And you can use the machines with the weights. For the leg lift one, there's a leg lift machine that works out the quads. The quads are especially important for helping the ligaments in the knee to do their job. And especially if you have an injury to the ligaments, your quads have to be real strong. So you want to do anything that helps the quads to stay strong. So all the muscles, your thighs, your glutes, your calves, your legs, you're going to have to work those out basically for the rest of your life so that they can all be strong. The stronger that they are, the better job they're going to do to keep that knee together and not let it buckle. All right. So the supplements. So these supplements are extremely important. They're extremely well known for helping joints and ligaments, and especially in the knee. So the first one is a herb. It's called cissus. Many people don't know about this, but there's been scientific studies done on this, and it shows that it strengthens ligaments in particular. And a lot of the way I learned about it is somebody told me about it because bodybuilders use it because they're at a risk of their ligaments snapping when they're lifting extreme weights. So they take cissus to strengthen the ligaments so that their ligaments don't snap. So whether you have a partial tear or a full tear, you want to take cissus. And even if you're not injured, if you just want to keep your ligaments strong, you want to take cissus regularly if you're involved in extreme sports. The next one is shark cartilage. I learned about this one from my coach, and I also heard George St. Pierre talking about it. The next one is fish oils. You basically just want to take fish oils for general health, but I would recommend them as well when you're coming off of an injury and you're trying to heal. And the last one is called glucosamine MSM, which is again for your joints and ligaments. So those are the main supplements that you should be taking. Of course, as well as eating healthy, regular exercise, fresh air, all of that stuff. All right? But these are the main supplements that you should be taking. If you check the description below the video, you'll find Amazon links to all of these supplements. So now let's talk about braces. Okay? There's two types of braces, the soft ones and the hard ones. If you're going to be doing wrestling and Muay Thai and these type of contact sports, you're going to have to use the soft one. The one that I recommend, I'm going to leave a link for it in the description of the video below. It's by a company called McDavid, but there's a bunch of companies that make similar ones. And what it is a knee brace that you put on that has like 2 cross bands that attach to Velcro that basically kind of like simulate the ligaments in the knee. And that's going to help to keep your knee a bit tighter, keep the area tighter so that you have less chance of re-injuring it or injuring it in the first place. And if you already have an injury, another thing that the brace does is that it constantly, because it's on your knee while you're training, it constantly reminds you that you have an injury so you don't get too loose, so you don't get too crazy, you don't get too wild. You can train consciously so that you don't re-injure your knee. The other type of brace is a hard brace. This is a type of brace that you can put on if you play sports like basketball or baseball. It's a hard brace and it's designed to wear, and it forces the knee to stay together as you run and jump and do everything. It's like a mechanical looking brace. It's a bit more expensive than a soft brace, but it can be used in sports like basketball and baseball where there's a lot of fast-paced running and movement. And I'll link that in the description as well. All right, so as a recap, supplements, okay, cissus, glucosamine MSM, shark cartilage, fish oils. Next thing, a knee brace, either a soft brace or a hard brace. After that, strengthening the muscles around the knee so they can compensate and do the job that the ligament is supposed to be doing. Increasing circulation to the area through massage, the stretches I showed you, exercise. Increasing in movements that make your knee vulnerable gradually and over a long period of time, giving your body the chance to learn. If you do those things, then you could be like Mickey Mantle or Thurman Thomas or John Elway and go back to doing your sports without any ACL at all. However, there is always a risk of re-injury, so you have to keep that in mind. But then again, once you've got that injury, even a surgery is not going to be 100%. Many people who've opted for the surgery say they never feel the same again. The knee isn't ever going to be 100% again. That they don't trust the knee completely, even though they've had the surgery. That they can't commit to the movements fully because they're constantly scared of their knee coming apart. So there's that factor, regardless if you get the surgery or if you don't get the surgery. But that's just how it is. Of course, prevention is better than cure. So try not to injure your knees, guys. You may want to wear, you know what? Even if you don't have a knee injury, let's say you have a partial tear even, or just, you injured your knee, but your ligaments are fine. You may want to take all those supplements, do all the stretches, wear the knee brace, do all of that just in case, so that you never end up hurting your knee in the first place. And if you're going to do takedowns, guys, make sure you execute with proper form, right? It's when you get very lazy in your technique and form and you do the technique wrong that you increase the chance of injuring your knee. All right, guys. So that's pretty much it. I hope the best for you guys. Hopefully that helped you. If you have any questions or comments, just leave them for me and I'll try my best to get back to you as soon as possible. All the stuff I mentioned, all the supplements, all the supplements, the braces, all the links are in the description below. And that's pretty much it. So I guess I will see you guys next time then, huh? All right, guys, let me get back to the gym and go do my thing. All right. It's your boy Salman with Izza MMA. Peace.